Hi everybody, my name's Doug and I'm doing this follow-up video to give you an update on my condition called bladder neck contracture. If you watched my previous video, I explained that after my TURP procedure I was starting to have some symptoms again very similar to BPH, and I had a couple of procedures done to correct my bladder neck contracture. And I just wanted to make this video to let you know how things are going. I apologize that it's been about 4 months since I made that last video. I appreciate all the emails that I have received from other guys asking me for an update, but I really wanted to go back to my doctor after my 3.5-month follow-up to find out exactly how I'm doing. So I'm doing this as a follow-up. So as a review, back in mid-2021, I was having BPH problems, enlarged prostate problems, just like most men know. Weak stream going to the bathroom, getting up multiple times at night to go to the bathroom, never feeling like your bladder is totally empty, and leaving the bathroom and having to turn around and go back in to go some more. Typical BPH symptoms. So as I said, I had a TURP procedure. Went back in for my follow-up about 4 months after my TURP procedure. Doctor scoped me again real quick and said, hey, everything looks great. The prostate looks fine, is wide open. He told me that prostatic tissue generally will not grow back, but if it does, it grows back very, very slow. So he basically told me that at 61, it's 2022 and I'm 61 years old, he said, I will probably have a very good, long, open prostate, hopefully for the rest of my life. So after my follow-up, went on with my life, and then after about 6 months or so, I noticed that I was starting to have issues again going to the bathroom. And they were symptoms very similar to BPH, where I had a very weak urine stream, getting up multiple times again at night to go to the bathroom, never feeling like my bladder was totally empty. And if you've got BPH, again, you know what I'm talking about. But this was after my TURP procedure. So I immediately, called my doctor, and I said, hey, doc, I'm having these problems again going to the bathroom after the TURP procedure. So I was very fortunate to get a very quick return date to my doctor's office. Went in, told him what was going on, and he pretty much told me right off the bat that I had something called bladder neck contracture. And what bladder neck contracture is scar tissue builds up around the bottom of the bladder neck. So I've got this diagram again that I kind of showed in the previous video. So here's the bladder, here's the prostate, here's Mr. Happy. We know what that's all about. And what bladder neck contracture is, right up here, you can see how small the opening is that goes into the urethra to go to the bathroom. And again, scar tissue starts to build up in this opening right here, and it slowly closes off that opening and it gets smaller and smaller. So when I went back for that second follow-up, the doctor scoped me again with the little TV screen, and he said, oh yeah, it was actually smaller than when he did the TURP procedure. The opening was smaller, and that was my issue, and it was closing up pretty fast. So he said, yeah, we need to get you in pretty fast to do a procedure. So the procedure was, again, general anesthesia. It only took about 10 minutes to do, but he stuck a couple instruments up through the penis, up through the prostate, up to the bladder neck, and he had a little heating element, a cauterizer, and just cut some of the scar tissue, kind of like just little cuts in that scar tissue, to allow the scar tissue to open up again, to open up the opening so I could go to the bathroom normally again. So I had that procedure done, and he said everything went well. And this time it was only about 2 months or so, and I kind of noticed again, here it comes again, and I noticed the same BPH symptoms of weak urine stream, and no matter how hard I pushed, it would just come trickling out. And, again, getting up a couple times a night, never feeling like my bladder was totally empty. So I called again. I was very fortunate to get in the very next day, And he said, I'm not even going to scope you. I'm just going to go ahead. Let's go ahead and schedule another procedure to do that cauterization again of that scar tissue. And he said, some guys, some women, they just have overactive scar tissue mechanisms, you know, and I'm one of those guys. So went in again about a week later after that second follow-up, you know, and this time he did the same thing, went up through the penis, up through the prostate, up to the scar tissue with that little cauterizer. Again, cut a bunch of little cuts in all that scar tissue around that. But then this time, on the second time, he injected a large amount, is what he called it, a large amount of steroids. Well, obviously everything is relevant. You know, your sphincter muscle is pretty small, and so a large amount, it's all relevant, you know, relative to the size, I guess. So I came home again, you know, I was on a catheter bag for a couple of days, you know, just for the bleeding and things like that. Pulled the catheter out myself at home, had no issues. But this time the doctor sent me home with catheters, daily catheters. And again, if you watched my previous video, I kind of explained the schedule, but I'll go over it again. I would catheterize myself once a night for about 2 weeks. And then it was every other night for about 2 or 3 weeks. And then it was every third night for about 2 or 3 weeks, and on and on and on. So I got to the point where it was pretty much maybe just once a week where I would catheterize myself just to make sure that everything was flowing normally, that the opening at the sphincter muscle and the scar tissue, everything was still open. It was going pretty well. So like I said, about 3.5, 4 months went by before I had my follow-up after the second procedure. Went in. Doctor didn't scope me, didn't put a TV camera up inside, didn't run any tests. You know, we just sat in his office, and he just asked me, Doug, how are things going with you going to the bathroom? And I'm happy to report at this point, everything is great. I'm going to the bathroom. I have a nice, steady, hard stream, like when I was a young man, like when we were all younger men. You know, I'm emptying my bladder. I don't have to go back in 2 minutes later to finish what I had started. Don't have to get up multiple times at night. You know, if I get up once a night now, you know, that's unusual for me. So I'm happy to tell you that there is hope if you do have a TURP or any type of procedure for that matter on the bladder, and you come down with that bladder neck contracture, there is hope. One thing that I would tell you is if you do come down with bladder neck contracture, you may want to go in, talk to your doctor, and you know, tell them or tell your surgeon, hey, you know, I was watching some YouTube videos doing research, things like that, and see if they would inject steroids into the scar tissue to hopefully stop the scar tissue from growing. So that's an option for you. Hopefully you won't have any issues, and hopefully you'll be going to the bathroom like a young man. Something else that I wanted to kind of discuss, and I kind of left some of this stuff out on some previous videos, you know, because my mind, you know, I didn't take any notes or to put in the videos. But a couple things I wanted to touch on that some guys have asked me through YouTube video responses. One thing that you may experience if you've never had a catheter and you have a catheter for several days, don't be surprised when it comes out. If you take it out yourself, and again, follow doctors' and nurses' orders how to properly and safely remove it. But once it's removed, don't be surprised if when you urinate, you get a pretty significant burning sensation in your urethra. And that's, I'm guessing, because, you know, they put some pretty good size instruments up inside your urethra. So I'm sure you've got some raw tissue and things like that in your urethra. So again, if you pull a catheter out, you know, the right way, again, when you urinate, don't be surprised if you have a pretty significant burning sensation that lasts maybe a week or 2 weeks. When I took mine out, every time I'd urinate, I would kind of have to grab onto the countertop in the sink in our bathroom and hold on, because it was pretty uncomfortable. So that's one thing that you may experience. Maybe you won't. I don't know. Another thing that I experienced after pulling out my catheter was abdominal cramping. And I don't know if that's because the bladder is waking up, and it's starting to squeeze, to get the urine back out. I'm not exactly sure how all that works. But I also noted that on top of the burning, I would urinate and there was pretty intense cramping inside my abdominal area. Again, don't know why, so don't be surprised if you cramp up a little bit. And again, that may last for a week or so. Both of those conditions lasted for about a week and a half with me before they finally started to subside as I was healing, as my bladder was waking up, learning how to squeeze again, if that's what it is. If you do have those issues, you can call your doctor's office and explain what's going on, and they will give you good medical advice. So as far as catheters, as I said, I had to self-catheterize myself. Many emails that I received from other men, they're nervous about a catheter. And I was too, to be very honest with you, because we're not used to shoving things up inside Mr. Happy. Here's what I can tell you. One of the most important things for men and women, because women obviously have bladders and sphincter muscles too. One of the most important things when you are inserting the catheter up inside your urethra, you will feel it going in. I guarantee it. You will feel it. It is not really painful. You'll just feel it. It's uncomfortable because you're sticking a tube up inside of you. But getting to my point, the most important thing, as you feel it going up inside of you, try to relax. You've got to relax. If you're all tensed up and your muscles, your abdominal muscles, your bladder muscles, your sphincter muscles, if those are nice and tight, it's going to be more difficult to get that inside of you. So after you do it once or twice, you'll kind of get an idea of how long the catheter is, and when you're going up inside, you'll kind of start to realize, okay, I'm getting close. As you're feeding it inside, you'll see the tube obviously disappearing inside of you, and you'll get an idea of when you're getting close. Plus, you will be able to feel it a little bit going up inside of you. So one thing that I was told, and one thing that I really want to stress to you, if you have to go on a catheter, a daily catheter, try to relax as best you can, especially the farther up you get. And when you get really close to that sphincter muscle, it's really important that you try to relax yourself. Maybe take a deep breath and just, relax, and then continue to slowly push it up inside. Once you see urine coming out of that catheter, you can maybe push it in, maybe just like another 1/4 inch or so, but once it's flowing, you really don't need to do a whole lot. You're just going to stand there and just let it flow out. One thing that I also noticed about me doing a self-catheterization was if I noticed that it still kind of felt like I had urine inside of me, if I slightly pushed it up just a little bit more inside of me, I would get maybe some more, or if I pulled it out just a little bit, I might get some more. It's just something, just be very careful. You don't want to jam it inside of you. You don't want to do any damage to your bladder. So just once it starts flowing, kind of get an idea. Hey, is there more in there? Maybe push it in just a little bit more, or pull it out just a little bit more. And I had to do both, and I had results going farther in or bringing it a little bit farther out, or maybe twisting it just a little bit. You're just going to have to get used to it. When you are pulling it out, as it's coming through your sphincter muscle, it's going to be a little bit uncomfortable again. Your muscle is going to start collapsing again, to close off your bladder. So you will feel maybe just a little bit of discomfort as it's coming back out through the sphincter muscle, and as you are bringing it out through your urethra, through your penis, or for a woman when you're pulling it out of your urethra. So, but again, if you have to do it, you'll get used to it. It is not that bad. I've had 2 different types of catheters that I have been prescribed, and they all come, if it's a reputable company, which obviously your doctor, your surgeon will give you a prescription for a reputable catheter company. and they all come pre-lubed. Now when I say pre-lubed, sometimes they will come with actual lube in it, or you may get a dry catheter that you can put squeeze lube on it. The ones that I was using, it was more like a sterile water. It wasn't a lube, it was more like sterile water. But still, I really did not have any issue inserting it up through my urethra up into the bladder. So again, it sounds horrible. I know that. I was worried about it too, but it's really not that bad. Once you do it a few times yourself, again, relax as best you can, and hopefully you won't have to be on one every day. So that's what I wanted to tell you about that. But again, just you know, to recap everything, my bladder neck contracture is doing really well. My TURP is perfect. So again, if you're thinking about getting a TURP, go for it. You know, there are other procedures out there that you can do. Do your homework, do your research, talk to your surgeon, but remember, it's up to you what you get done. Don't let them talk you into anything or out of anything. You know, do your research, do what you feel comfortable with, and you know, go find someone who will do that for you. Again, the catheters, no big deal. There are a couple videos showing guys actually doing it. I'm not going to show you, you know, because they're already out there, and I'm not going to show you what I've got. So that's the update on that. Just want to let you know that I'm going to hopefully be doing another video here, and I may actually show some catheters, you know, what I have. I still have 5 boxes of catheters, even though I was told to stop doing that and just, you know, let's see what happens. So I've got 5 boxes of catheters in my basement just sitting there. Hopefully I won't need them, but so things are looking up really well for me, which is good. Something else that I'm probably going to do a video on, if you remember back in the good old days when Saturday Night Live was actually funny and wasn't so political and anti-conservative, you know, that's all I'm going to say about my political beliefs. But way back yonder, there used to be a skit where they had 2 guys, I couldn't tell you who they are, but they dressed up in gym outfits and they were real muscular, and they would say, "We're here to pump you up." Well, I'm here to tell you that I'm pumping myself up. I had some surgery done because I was having some issues down there also. So I'm going to try to put together a video of my experiences. It's almost been a year now since I've had that pump up situation rectified, and just want to give you some information about what you can expect if you have to go through that. Again, it's not a pleasant experience, but it's not bad. So you can expect that. Plus I may have some other videos of some of the things that I do for a part-time job. I think you'll enjoy watching some of those videos. So that's all I've got for you. I know I've wasted a lot of your time, but if you don't mind, give this a thumbs up, give it a like. If you want to subscribe, that's fine. Hopefully, you know, we can get this information out to as many guys as we can. So I appreciate your time. If you're going to have a TURP or any other procedure, if you have bladder neck contracture, I wish you the best. God bless you. I'm going through it too. We're all in this battle together. So again, I wish you the best. Stay safe out there. And again, God bless you all. And I will be in touch very soon. Thanks.